Hello everybody, my name is Victoria Cerda. I'm a current third-year resident at Cedars Sinai. I will be presenting oligoprogression on PARP maintenance in ovarian cancer. What's the story and where do we go? Ovarian cancer is notoriously known to recur after primary treatment. Around 70% of recurrences occur within the first 2 to 3 years, therefore it is very common for women to undergo further surgery and/or additional courses of systemic treatment. Maintenance chemotherapy, specifically PARP inhibitors, have made a significant impact for ovarian cancer by decreasing disease progression or death, as seen in SOLO 1. Unfortunately, recurrence still occurs. However, there may be patients in which the recurrence is oligometastatic, meaning only a few lesions. Recurrent lesions may be surgically removed, a new chemo line can be started, and as seen in recent studies in non-small cell lung cancer, metastatic lesions may be subject to radiation treatment. So what about radiation treatment in ovarian cancer? This study demonstrated a complete response to radiation treatment in 65.2% of the lesions and a partial response in 23.8% of lesions. Mild toxicity was experienced in 20.7% of the patients, therefore confirming the activity and safety of radiation treatment in ovarian cancer. So recent studies support the role and safety of radiation in metastatic disease. Now let's define a few terms. Oligometastatic meaning having a few metastatic sites, typically 1 to 3. Oligoprogression meaning a state where after an initially successful systemic therapy of disseminated metastasis, a single few lesions display further progression. So do patients on PARP maintenance for ovarian cancer express oligoprogression in their recurrence? So the primary outcome was to investigate the proportion of patients on PARP maintenance who develop oligoprogression. Secondary outcomes were to determine clinical outcomes for oligoprogression versus non-oligoprogression and the association between BRCA status and oligoprogression. This is an IRB-approved retrospective chart review utilizing Deep6 AI. Inclusion criteria were patients aged greater than or equal to 18 years old and on maintenance olaparib between the years of 2006 and 2020. Exclusion criteria were less than 18 years old, no recurrence on PARP, loss of follow-up, and missing data. A subset of patients with oligoprogression were identified and assessed for sites of recurrence based on radiologic findings. Pearson's chi-square was used for differences in categorical variables and Kaplan-Meier to estimate survival outcomes. There were no significant differences in baseline characteristics between the two groups. Primary tumor was predominantly of ovarian origin, 84% of patients had FIGO stage 3 disease, and 87% were serous. 59% of patients had a BRCA1 or 2 mutation, patients had a median of 2 lines of chemotherapy prior to starting PARP, and a majority of patients were on PARP for less than 10 months. 11 patients developed oligoprogression, which we define as less than or equal to 3 sites, the most common sites being pelvic or periaortic nodes, peritoneal, and liver. 7 out of 11 patients with oligoprogression were BRCA mutation carriers. No difference was seen in progression-free survival between the two groups. And again, no difference was seen in overall survival. However, the median overall survival has not been met as greater than 50% of the population is still living. Oligoprogression occurred in about a third of patients on maintenance olaparib. Natural history appears similar in terms of overall survival and progression-free survival, and therefore a larger data set is needed to validate these findings to determine if trials investigating local therapy for this group of patients is worthwhile. Mutations included a small patient population, retrospective study which is subject to bias and only looking at olaparib. Strengths were no current data on this topic, looking into BRCA status for oligoprogression and sites being validated by 2 readers. Here are my references. Thank you for listening, and I would appreciate any feedback or questions.